Welcome into Healthy Living on the Morning News on this Wednesday. Well, imagine if one of these could someday be used to track a patient's health, cut down on doctor and emergency room visits, and also better manage a condition that can cause strokes. New study is underway in Nova Scotia, bringing together a cross-section of experts from computer scientists to researchers to family doctors to see how technology can be used to help patients with atrial fibrillation. And joining us with more is the lead investigator, Dr. Jafna Cox. He's the Director of Research in the Division of Cardiology at Capital Health. Dr. Cox, thanks very much for coming in. We appreciate your time so far this morning.
Well, thanks. It's a pleasure.
So, first of all, for me, to learn more about this, what is atrial fibrillation?
Atrial fibrillation is the most common abnormality of heart rhythm that people develop over the course of their lifetime.
Okay.
And it is a disease that is age-related, so the older we get, the more likely we are to have it. In fact, any of us over the age of 40 have a 1 in 4 chance of developing atrial fibrillation.
1 in 4?
1 in 4, and
Wow.
Unfortunately, as males, we have a slightly higher likelihood of getting it than the women do.
Okay.
And the real issue with atrial fibrillation, insofar as major problems, is that it is a very common cause of stroke. So at least 20%, and probably closer to 25 or more percent of strokes are due to atrial fibrillation. And the problem with an atrial fibrillation related stroke is that they are very serious. So 20% of the time you will die from them.
Wow.
And 60% of the time major disability is going to result.
So why pick this particular atrial fibrillation for the study, and what about this app that
So I think there's a number of reasons for picking atrial fibrillation. First of all, we are an aging society, and in Atlantic Canada and Nova Scotia in particular, we're among the oldest populations in Canada, and so this is a thing that is going to become increasingly prevalent in terms of conditions that we're dealing with. It's a significant drain on the healthcare system in terms of emergency department visits, hospitalizations, and then obviously the unfortunate people who do have strokes and survive them. And it is a condition that we believe can be appropriately managed in primary care if primary care physicians and their patients and the patient families are provided the appropriate resourcing to allow them to do a good job.
Right.
And so that was the reason why it was chosen. Atrial fibrillation also relates, particularly with respect to stroke risk, with a series of other age-related conditions like hypertension, high blood pressure, diabetes, heart failure, and so forth. So it's very much, again, a disease of the elderly. We're an aging society. It's something that we're going to have to come to terms with. Our healthcare system, as we know from what we've been hearing recently on the election trail, is under a certain amount of siege, as it is elsewhere. And if we can do anything to unload the hospitals and unload the emergency departments and empower better the patients and the primary care physicians, then I think we'll be further ahead.
So how does the app work? How can the phone benefit the patient?
So basically what we are doing is we're doing a clinical trial, which is the usual metric that we use to test a drug in terms of the efficacy of a drug, and we're going to be doing that instead of a drug, a decision support tool. So instead of, there's thousands of apps, as you're probably aware, that deal with health on iTunes, and you go and for $9.99 you can pick one up. And the problem is none of these have really been tested. And so what we're going to be doing differently is developing a decision support tool that will be able to pull information from a series of data sets related to the patient that can monitor the patient in terms of medication that they're on, in terms of their labs and so forth, alert physicians to have physicians deal with the patient sooner rather than later, but at the same time have an ability through a smartphone type device or a tablet or a computer at home for a patient to enter information, for a patient to get educated about their condition, and for them to feed in important metrics to us so that if their symptoms change or if there's something else that's remiss, that they have a way of contacting the primary care provider and being brought in and seen sooner rather than later.
Certainly is fascinating stuff. What's the timeline for this app in the development stage?
So the app is under development right now, and we're hoping to have it more or less completed by the end of this year or the beginning of next year. We're working with the Department of Health as essential co-investigators as well as Doctors Nova Scotia. Over the course of the next couple of months, we're going to be reviewing primary care practices across the province to see how many of them we can get interested in becoming enrolled in the trial. And then we're hoping that in first quarter of 2014, we will begin to enroll our first patients.
Wow. Wow. Where can people find out more information about the study?
They can find out more information through the CADHA website. There will be information through Doctors Nova Scotia. And if you Google the name of the study, Impact AF. We have a website that we're getting started, and that will provide you with even further information. So stay tuned.
Okay, Impact AF.
Impact AF.
Okay, Google that on a Wednesday morning. Impact AF. Dr. Jafna Cox, thanks very much for coming in to talk to us.
Oh, thanks very much for having me.